If you are pregnant, then you must be curious about the gender of your baby. Ultrasound science for determining baby's sex is very important for all the pregnant women at this stage. If you have chosen to find out the sex of your baby, you are almost likely going to do so via ultrasound. Typically, the ultrasound is done halfway through the pregnancy. It is called the fetal anatomy survey, and it is done to look the fetal anomalies, not simply to find out the sex of your baby. The accuracy of the report will depend on many factors, including the age of the baby, the equipment used, the technician, and the baby. However, there are certain signs in boys and girls ultrasound pictures that the technicians use to determine the gender of your baby. Number 1. Absence of penis or girl theory. One sign that mothers think automatically indicates a girl. For example, it is absence of penis, girl theory. This theory states that if the ultrasound technician fails to find a penis, the baby is automatically a girl. We will see here is more to a girl ultrasound picture that the absence of a penis. In fact, particularly early on the pregnancy, a clitoris or penis are roughly the same size and shape. Number 2. Hamburger sign. When doing an ultrasound to determine the sex of your baby, an ultrasound technician will actually look for girl genitalia, labia, and clitoris. When these are seen, it is often referred to as the hamburger sign. The clitoris situated between the labial lips looks like a hamburger between two buns or three lines. The labia would be the buns of the hamburger and the clitoris would be the meat. Number 3. Turtle sign. When the ultrasound technician is looking for a boy, they are looking for something called the turtle sign. This is where you can see the tip of penis peeking out from behind the testicles. This may be harder to see when some babies, which is why there are multiple signs to look for during an ultrasound. The gestational age and position of the baby play a part in what can be seen. Number 4. Erect penis. Even as a fetus, baby boy can and will have erections. If you happen to be looking with ultrasound during that time, you will see a very clearly defined penis. This obviously makes identifying a baby boy much easier. Seeing an erection may bother some parents, but don't worry, it is normal for boys to have erections. You will notice these after birth as well during diaper changing. 3D and 4D ultrasounds. The greater availability of 3D and 4D ultrasounds has changed how ultrasounds determine a baby's gender. Ultrasounds are often more accurate because you can see baby parts more clearly as opposed to guessing from shadows. Remember, before 18 weeks, the clitoris and penis are roughly the same size and can easily be mistaken. Although you understandably really want to know the gender of your baby and prepare for his or her birth, it's best to be patient. No matter what type of ultrasound you use, there will always be errors, especially with early ultrasounds. The ultrasound taken at the time of 9th month may be somewhat accurate, but for that, the head should be at the downside and the legs should be at upper side so that you can see the gender easily. Share this video with the females who are pregnant and want to know the signs and symptoms of would-be baby boy or girl through ultrasound. Thank you.